Thank you so much for having me here. So today I want to talk about one of the most important things that we have, which is about our healthcare, about our health. Uh, so I want to start my presentation with a combination of the way that we are going to transforming our world by 2030, which is the important agenda that has been created by the United Nations in 2015. And they encourage all countries around the world to achieve these goals, which is going to be 17 goals, so I'm going to talk about that 17 goals in the next page, to implement the prosperity, fulfillment, and end poverty around the world, protect our environment, protect our resources, our natural resources, climate change, to handle this world in a better situation for to the next generation. So the United Nations have established these 17 goals, as you can consider here. For instance, the end of poverty, zero hunger, health and well-being for all around the world. We have innovation, considering the life under the ocean, on the land, having the smart cities, or having the partnership and bringing the clean energy for all in accessible and affordable formats. One of these top goals that we have here is about the health and well-being for all. Let's look at the situation that we have after 10 years. Okay, what's going on around the world? So, 300 million people live in extreme poverty yet. 50% of the world lacks access to essential healthcare services, which is approximately 4.5 billion people around the world. Still, we have inequities in healthcare services in rural areas and many low-income countries. The medical error is one of the top issues that we have, which is the third leading cause of death after cancer and heart disease in the United States, and in the global scale. We have over 138 million people who are affecting the harm due to the medical errors. Okay, and the top of the medical errors is medical diagnosis, misdiagnosis, medication errors, communication problems, which is one of the important topics that we have among the healthcare professionals and clinicians, how we can establish a better, effective communication, which is part of the soft skills. Most of the time we say, okay, we have a misdiagnosis because of the lack of knowledge, but this is kind of another soft skill that must be considered. Infection control errors is another important issue that we have around the world. And so due to the, for instance, social media and the lifestyle change, we are experiencing the increase of mental health disorder around the world. And also, based on the mega trend that we have, the aging population growth is another challenge that we are facing, especially by 2030. So 1 in 4 person will be over 65, and the healthcare system must be responsible and respond to the needs of these particular aging population. The shortage of nurses, physicians, is another important challenges, and also the ethical issues, which is regarding the patient privacy and document confidentiality, is another important problem that we have in healthcare, with the rise of high out-of-pocket costs for the insurers and for those who want to have affordable healthcare services. Okay. And climate change definitely is another important factor that is impacting the health and well-being of the people around the world. Another issues that we have, and many countries still are struggling to achieve the Sustainable Development Goal number 3, is about the lack of access to the internet. Here is the AI conference. We are talking about the AI technologies, internet, data, big data, robotic, many products that I've seen today. These are all about the product and service that we have. How about the countries that don't have even access to the internet? They don't have access to the affordable healthcare services to use your product, use your service in their countries. This is going to be another important issues that we have, even with having all these emerging technologies in healthcare system. So if you compare the advanced countries who are adopting the AI solutions or robotic, virtual reality, big data, electronic health records, we still have many issues in other low-income and middle-income countries to create equity in healthcare and reduce the disparities. This is a kind of visual slide that you can see how the evolution of healthcare has been changed through all these years, from the paper-based services through the electronic services, and the future we will have more internet on the go, and also having the healthcare on the footprint of everybody. So this is another great example of the evolution that we experience in healthcare industry. For instance, these are the surgical devices, from the simple surgical devices to the robotic surgery or telehealth surgery. These are the great advancements that we've been experiencing all these years through the healthcare evolution. This is an infographic that I've created based on the study of over than 200 resources regarding the healthcare situation from the past, present, and future. So based on this infographic, and this is the infographic which is kind of well aligned for the healthcare industries in the most advanced countries. For instance, when I talk about the paper-based services in the past, so the advanced countries such as United States, they have access to these parts, and they have this shift from the paper-based services to electronic-based services. But many other countries, as I mentioned earlier, especially in low-income countries and middle-income countries, most of them, they are still using the paper-based services. But if we want to mention some of the important parts of this past situation, is about the way that we are shifting the behavior of the patients, especially for the next generation, for the Gen Zs. They are the technology-savvy generations. They know better than previous generation about the internet, about the technologies. So the doctor is going to be the guide for the patients in future. Rather than being the authority, they will be the guide. They will advise the patients, and the patients will be the empowered and informed individuals who have access to all their medical records. They have the completely engagement of their decision making for their health and well-being. And also we will have the shift from the treatment to preventive care, and also having the lifestyle promotion. This is another important part, and these are going to be a good solutions for many healthcare application developers or companies, because when we talk about any innovation, it is important to learn about the gap in the market so we can bring the right innovation technology for our patients, for our healthcare user. Okay, so for instance, the illness care, which was the past part, now we will have the life care and The next step is going to be the way that we can design and develop their service and product based on the human-based centric design. How we can bring the complex problems around the world. I talked about some of the issues in previous slide, and how we can create those services or tailor our products to respond to the needs and expectation of those patients. We will have the hospital at home, which is happening now in many hospitals in the United States, and then ubiquitous digital healthcare is going to be another future. Another important future that I would like to talk about, this one I published recently an article which is about the digital self-care intervention. In future, we will have the data ownership for the patients, so the patients have all the information, medical information, health information in their own iCloud, in their own hands, and then they are in charge and they are the decision maker if they want to distribute this information with their provider of choice or not. This is another important part of the shift that we will experience in future, digital self-care intervention and having more doctor AI or chatbots or other technologies for the healthcare users. This is the market that we are experiencing. For instance, we have 350,000 medical applications out there in the market at a global scale. We have 900 AI learning-enabled medical devices that has been approved by the FDA this year. And as you can see here, 86% of the healthcare organization in the United States, they are adopting the AI technologies, and they are experiencing the productivity improvement, performance improvement, the reduction in readmission of the hospitals, and also the annual saving, which is kind of approximating $9 billion for the USA organizations' revenue cycle. So we have many pros of the AI. We talked about this part a lot, especially in this conference. So in a healthcare part, the AI can bring the personalized health services. It provides the opportunity for patients to empower themselves and engage in their medical treatment. It improves the population health. It brings the telehealth services to reduce the disparities and also bring the accessibility for the patients so they can have access to their healthcare providers via the distance. And also, we have the efficiency improvement or early detection of the disease through the AI. But we have some important challenges with the AI in healthcare, because the healthcare, when we're talking about the health, it's about the human being. It's about our life, okay? So it is important to have a right AI, correct AI, responsible AI, or, the precise AI for human. So in a study, it was showing that most of the Americans, they don't like to have the doctors just rely on the AI for making decision about their treatment, okay? Because we have an AI hallucination. Sometimes it recommends some wrong information for the patients that can have a potential harm or injury for the patients. We have inaccurate recommendation, AI bias, and also the issues such as lack of emotional intelligence that we have in AI. For instance, when you go to the hospital, you would like to have an emotional intelligence. You would like to have a compassion and the effective communication with your care provider, right? So this is important for us, and the AI cannot provide this, okay? Okay. So this is the vision that we have for 2030 if we want to establish the sustainable healthcare for our system. I divided in 4 important pillars, because when we talk about the sustainability, most of the people think that, okay, sustainability is about the, for instance, green energy, saving the energy, or reducing the carbon footprint. But it's not just about these parts. It's about the way that we can, for instance, bring the personalized care services for our patients. I put it as a precision-centered care, which is combination of the patient-centric services and precision medicine. So we have a comprehensive information about the patients. It's not only about the patient's history or physical history of the patient. It's about the comprehensive or holistic view of the patients, from the physical and mental histories, environmental, socioeconomical, cultural, everything that can bring to the AI to bring the or create a holistic view for a patient, so we can have a comprehensive information. If we want to have a treatment for a patient, we can have all this comprehensive information and provide the correct and precise prescription, treatment, alternative treatment plan, or even order it preventive medicine for the patients. Operational excellence, environmental sustainability, and health equity by design. This is another important part when we are in a high-tech conference. This is another important that most of the high-tech companies, if they want to design an application or software, they have to consider that part to contemplate how we can have a human-centered design to answer the real needs and expectation of the patients. Because most of the time, they just design a product and offer it to the market. This is not the correct way for the healthcare industry. We have to go and ask the patients what they want, what they need, what is their expectation, what is their problem, what is the gap for those specific population. And then based on that specific needs, we have to come back and create or design a project, product, or service that we want to offer to those patients. These are the strategic roadmap that we suggest for attaining the goal number 3 in Sustainable Development Goals. First of all, this is going to be immediate action. When in 2015, when I was thinking about the Sustainable Development Goal, I was thinking, okay, it is going to be 15 years, but now it is only 5 years. And as you consider that in previous slides, we are still behind the curve of achieving the accessibility and affordability of care services for all people around the world, okay? So the first part, immediate actions versus long-term strategic planning. We have to think about life cycle of the human being. It is important when we are producing something to think about how we can create a sustainable product, how we can have a regenerative product, okay, to minimize the harm of the environment, our all beings, our human, and all creatures that we have around the world. So we want to protect our planet. And then another part is about the strategic alignment at global level with the local level, which is another important issues that we are having in the healthcare industry. And also when we are fostering the future leaders, it is important if we want to have visionary leader. Beside that part, we have to empower them how they can be a sustainable leader. And creating the purposeful value creation is going to be another important part. So what we have done in Sofia University, so we have a comprehensive program in DBA and a doctorate in business administration and MBA administration, and also transpersonal psychology. We have combined all these important factors regarding the sustainable development goals in our program, so we foster the future leaders leaders, future managers and directors in different organizations to learn how they can adopt the sustainable development goals and how they can protect our planet to handle this planet with a better situation to the next generation. So this is one of the goals that we've had, and this is a great example of the technology design, which is based on the human-based design that we are working on it in Sophia University in Bay Area. So, and I would like to invite you if you like to partner with us or invest in this kind of projects, which is a software as a service solution to have a whole person healthcare AI with considering not only the biometrics or physical factor, but also the environmental, cultural, and socioeconomical factors of the patients or the healthcare users to make sure that we have a holistic view of the patients through these applications. It has a capability of interoperability, and it provides a whole person insights for healthcare team. And this is another example of the case that we are working on it, which is through the City and Health. This company is a startup company, and we work to have the solution for the patients in rehabilitation centers. This solution is completely HIPAA compliance, and we have this solution based on the precision center care services. Okay, sure. Yeah. Okay, thank you so much. Really appreciate for considering my presentation. If you like to learn more about these projects, if you like to be partner and investor, so I would be happy to connect with you through this email and talk to you about this one. Thank you.